There is a compound sitting in your extra virgin olive oil right now that works on the exact same pain pathway as ibuprofen. Scientists didn't discover this by studying ancient remedies or folk medicine. They discovered it by accident when a researcher at a conference in Sicily took a sip of freshly pressed olive oil and felt an unusual stinging sensation in the back of his throat. That sting, he realized, felt identical to the sting he had felt years earlier when he swallowed liquid ibuprofen during a completely unrelated study. That observation led to a landmark paper published in the journal Nature in 2005, and it changed how scientists think about olive oil forever. The compound is called Oleocanthal, and once you understand what it actually does, you will never look at a bottle of extra virgin olive oil the same way again. And the reason people have been mixing it with salt for pain relief turns out to be far more grounded in real science than most viral posts will tell you. So here is what the Nature study actually found. The researcher, Gary Beauchamp from the Monell Chemical Senses Center in Philadelphia, and his colleagues isolated the compound responsible for that throat sting. They named it oleocanthal, from the Greek words for olive and sting. Then they tested what it did inside the body, and what they found was remarkable. Oleocanthal inhibits the activity of cyclooxygenase 1 and cyclooxygenase 2 enzymes, which are the exact enzymes that ibuprofen blocks to reduce pain and inflammation. The mechanism is identical. But here is the part that surprised even the scientists. At equal concentrations, oleocanthal was actually more potent than ibuprofen at inhibiting those enzymes. At a concentration of 25 micromoles, oleocanthal inhibited between 41 and 57% of cyclooxygenase activity, while the same concentration of ibuprofen only inhibited between 13 and 18%. That is not a small difference. That is oleocanthal outperforming one of the most widely used pharmaceutical anti-inflammatory drugs in a laboratory setting. Now, I want to be very honest with you here, because this is where most viral posts get it wrong. The amount of oleocanthal in a daily serving of olive oil, about 50 milliliters, is roughly equivalent to only 10% of a standard dose of ibuprofen. So no, drinking olive oil will not cure your headache. But here is what the science suggests. Chronic daily consumption of oleocanthal-rich olive oil may provide a small, steady anti-inflammatory effect over time, the same way a low daily dose of ibuprofen is known to reduce the risk of certain chronic diseases. That is the real power. It is not about instant relief. It is about what happens over months and years. Now, here is where this explainer gets genuinely interesting. This is not just about drinking olive oil. People have been mixing salt with extra virgin olive oil and applying it directly to painful areas, joints, sore muscles, stiff knees, aching backs. And the research behind why this might actually work comes from multiple directions. The first is Dead Sea salt therapy. The Dead Sea, located between Israel and Jordan, contains some of the highest concentrations of magnesium, calcium, and potassium of any body of water on Earth. People have been bathing in Dead Sea water for rheumatic pain for thousands of years, and modern clinical trials have tested this rigorously. In a randomized controlled trial published in the Journal of Rheumatology, 30 patients with active rheumatoid arthritis were divided into two groups. One group bathed in Dead Sea salt water, and the other group bathed in ordinary sodium chloride solution. After just 2 weeks, the Dead Sea group showed statistically significant improvements in morning stiffness, grip strength, walking time, and overall disease activity, improvements that lasted up to 1 month after treatment ended. The sodium chloride control group showed no such improvements. A Cochrane review of mineral bath therapy for osteoarthritis found silver-level evidence that mineral baths reduce pain compared to no treatment at all. And a major systematic review published in 2026 analyzed 9 clinical trials totaling 465 patients and found consistent short-term improvements in pain and physical function, particularly for osteoarthritis, with no serious adverse events reported. The minerals that appear to matter most are magnesium, which relaxes muscles and has natural anti-inflammatory properties, and potassium, which helps regulate fluid balance in tissues. The second piece of evidence comes from transdermal magnesium research. A Mayo Clinic pilot study published in 2015 enrolled 40 women with fibromyalgia and had them apply a topical magnesium chloride solution to their limbs twice daily for 4 weeks. The results showed significant improvement in fibromyalgia impact scores by the second week, and the improvement continued through the end of the study.
A separate study published in 2017 found that applying a magnesium cream for 2 weeks produced a measurable increase in serum magnesium levels compared to placebo, confirming that magnesium does cross the skin barrier in clinically meaningful amounts, particularly through hair follicles. And a 2016 review in the journal Nutrients, analyzing 81 randomized controlled trials, found that magnesium treatment reduced pain intensity across multiple conditions, including migraine, fibromyalgia, and post-operative pain. So when you combine salt and olive oil into a paste and massage it into a painful area, you are potentially getting 3 things at once. The oleocanthal from the extra virgin olive oil is a natural cyclooxygenase inhibitor, working on the same inflammatory pathway as ibuprofen, but delivered directly to the skin over the painful area. The minerals from the salt, especially magnesium, are being absorbed through the skin where they can help relax muscles and reduce local inflammation. And the act of massaging the paste into the skin increases blood flow to the area, which itself is a well-documented pain relief mechanism. Heat and increased circulation help flush out inflammatory byproducts and bring fresh oxygen and nutrients to damaged tissue. The olive oil also acts as a carrier that helps the skin absorb the minerals more effectively while preventing the salt from being too abrasive.
Now, how do you actually make this? And more importantly, how do you do it right? Here is the practical method that follows the research. Take about 2 tablespoons of coarse sea salt, ideally sea salt or dead sea salt rather than refined table salt, because you want the magnesium and trace minerals, not just sodium chloride. Mix it with enough extra virgin olive oil to form a thick, spreadable paste. The key here is that the olive oil must be genuinely extra virgin, and here is how you know if yours qualifies. Take a small sip of the oil and let it coat the back of your throat. If it produces a sharp, peppery, stinging sensation, your oil is rich in oleocanthal. If it tastes smooth and bland, it has very little oleocanthal and it will not give you the anti-inflammatory benefit you were looking for. The stronger the sting, the higher the oleocanthal content and the more effective it will be. This is the single most important factor in whether this remedy actually delivers anything beyond placebo. Apply the paste directly to the painful area, massage it in using circular motions for about 5 to 10 minutes, and then leave it on for another 15 to 20 minutes. Some people wrap the area loosely with plastic wrap or a warm towel to increase absorption. Repeat this once or twice daily. The research on dead sea salt therapy suggests that consistent daily use over 2 to 3 weeks produces the most noticeable improvements. But I want to be completely honest about what this is and what it is not. This is not a substitute for medical treatment. If you have a serious joint condition, an acute injury, nerve pain, or unexplained pain that has not been diagnosed, you need to see a doctor, not mix kitchen ingredients. Salt and olive oil paste is a complementary approach that may help with chronic inflammatory pain like mild to moderate osteoarthritis, general muscle soreness, or age-related joint stiffness. It is not going to regenerate cartilage. It is not going to cure rheumatoid arthritis. What it may do, based on the evidence we have, is reduced pain and inflammation through 3 real mechanisms that have been individually validated in clinical research. There are a few cautions you should know about. Do not apply this paste to broken skin, open wounds, or areas with rashes, because the salt will sting and could cause irritation. If you have very sensitive skin, test a small area first. If you are on blood thinners, be cautious with any remedy that increases circulation to an area and talk to your doctor first. And if you are pregnant, check with your healthcare provider before applying anything medicinally to your skin. Also, do not use this paste on your face or near your eyes, and wash your hands thoroughly after applying it. So here is your takeaway. Extra virgin olive oil contains oleocanthal, a compound that inhibits the same pain enzymes as ibuprofen and was confirmed in a landmark Nature study. The sting you feel when you taste good olive oil is oleocanthal telling you it is there. Sea salt, particularly mineral-rich sea salt, delivers magnesium and other minerals through the skin, and clinical trials at the Dead Sea and at the Mayo Clinic have shown measurable pain improvements from mineral therapy. When you mix them together and massage the paste into a painful area, you are combining a natural anti-inflammatory compound, a mineral delivery system, and increased blood flow into a single practical remedy that has more scientific support than most people realize. The key is using genuinely extra virgin olive oil with a strong throat sting, mineral-rich salts, and doing it consistently over weeks, not expecting a miracle from one application. If this gave you something genuinely useful, hit like, subscribe, and drop a comment telling me which joint or muscle area you are going to try this on first. I read every comment, and your experience might be featured in the next